All right. My hello and welcome to all of you in this psychiatry session. As far as psychiatry is concerned, for PG entrance, NEET PG, NEXT and INICT, it is a short subject for PG entrance. So it is a part of the exam under medicine and allied subjects. Okay, it is a part under medicine and allied subjects. This subject is not an independent subject in final year MBBS curriculum. It is included under medicine. There are 4 subjects: skin, anesthesia, radiology and psychiatry, which are allied under surgery and medicine specifically. Psychiatry is allied under medicine, just like dermatology. But for PG entrance, it holds a specific weightage, specific value. SARP has a significant weightage in PG entrance. As far as psychiatry is concerned, since most of you are first timers with this subject, I must make you understand that this subject holds a specific value in entrance examination, qualifying examination for all the exams, and this particular video is the introduction to this subject, where we shall be understanding how we are going to cover this subject. As far as psychiatry is concerned, we are going to divide this subject into 4 sections. The complete subject shall be covered into 4 sections. Section 1 is going to be general psychiatry. Any subject in MBBS, you start reading with the general part first. General part means basics, understanding how the patient presents, the signs and symptoms. Like you read general pharma, you read general patho. Similarly, we shall read general psychiatry first, the understanding. Then we shall move on to clinical psychiatry. Clinical psychiatry means all the diseases and the disorders, starting from psychotic disorders, schizophrenia, delusional disorders, to mood disorders, mania, depression. We shall discuss one by one. Anxiety disorders, then organic disorders, substance use disorder, child psychiatry, and so on. This is the biggest unit. The third unit is known as psychology. Let me clarify at the beginning itself that psychology and psychiatry are 2 different things. Psychiatry is the study of diseases of human mind, while psychology is normal human mind and behavior. Psychology is more of a humanities subject. Students study psychology as early as class 11th and 12th in school. Students study psychology in BA, BSc, MA, MSc. So you study psychology early as well. Okay. The 4th section is going to be psychopharmacology. This section is an overlapping topic between my subject and pharmacology, that is the drugs used in treating psychiatric disorders. It includes your antipsychotics, antidepressants, anti-manics, etc. This, whatever I have written so far on the screen, is just the syllabus of my subject. This is an introduction video. In general psychiatry, we shall talk about basics, symptoms. In clinical psychiatry, we shall talk about disorders. In psychology, we shall talk about normal human mind and behavior. And in psychopharmacology, we shall talk about the drugs. How I am going to teach you this subject? The first few hours, the first few lectures that you are supposed to watch in this recorded video is general psychiatry. Please understand this. First watch general psychiatry lecture, then only you will understand clinical psychiatry. Because if you don't understand basics and the symptoms, you cannot proceed ahead with disorders. Thirdly, psychology and psychopharmacology, I will integrate it with clinical psychiatry. So when I shall be teaching you schizophrenia, at the same time I shall be teaching you antipsychotics. When I shall be teaching you depression, at the same time I shall be teaching you antidepressant. When I shall be teaching you mania, at the same time I shall be teaching you anti-manics. Some of you might be having the DAMS study material book, a book authored by myself known as DAMS concept book, in which I have classified these 4 divisions under 10 chapters. Have a look here. The syllabus of psychiatry is divided into 10 chapters like this. Chapter number 1, general psychiatry, where we shall understand the basics, the symptoms, the understanding, how the patient presents, how psychiatry is different from other subjects, how history taking is done, how examination is done, how do we approach in diagnosis in psychiatry. So first few hours is just terminologies. Then we shall go from clinical psychiatry from chapter 2 to 8 in the book: psychotic disorders, mood disorders, neurotic, organic, substance, child, sleep eating, and sexual and personality. This is called clinical psychiatry. Finally, psychology, psychotherapy, and community psychiatry is the third section. And the last section is psychopharmacology. I hope the introduction to psychiatry part is clear. I hope the introduction to psychiatry part is clear. In introduction itself, I would like to introduce this subject as functional neuroscience. Psychiatry is also known as functional neuroscience. You will be seeing this word often used. One is organic neuroscience. Organic means where the cause is known, and functional means where the cause is not known. The brain disorders come under organic. The mind disorders come under functional. Basic understanding. So anything that's related to brain comes under neurology. Anything that's related to mind comes under psychiatry. This is the first basic lesson. What is the difference between neurology and psychiatry? Whenever somebody uses the word functional, that means psychiatry. Whenever somebody uses the word organic, that means neurology. Functional means mind. Mind is the functional part. Brain is the anatomical part. When the cause is known, example, Parkinson disease, stroke, cerebrovascular accident, cause is known. Example, depression, where the exact etiology is not known. Schizophrenia, where the exact etiology is not known, comes under functional. Let me clarify. We are going to discuss functional neurosciences, that is psychiatry. The first MCQ, the term Psychiatry was coined by John Reel. This question had come in a previous JIPMER entrance exam. I hope you people are aware about JIPMER entrance exam. Previously we had INI-CT entrance, now we have INI-CT entrance exam, which include AIMS, PGI, JIPMER and NIMHANS. Previously we had these 4 separate exams, in which one of them was JIPMER, where this question was asked. Along with this, regarding history of psychiatry, let's discuss 2 more questions. Who is father of modern psychiatry? The father of modern psychiatry is Philip Pinel. Why Philip Pinel is called father of modern psychiatry? Because he unchained the mental patient. Before Philip Pinel, psychiatric patients were kept like animals in a zoo are kept. So he was the first person who gave a humanistic approach to psychiatry. Humanistic approach to psychiatry. This question has come previously in an entrance exam called NIMHANS. NIMHANS is a separate institute in Bangalore in India, Karnataka, which is National Institute of Mental Health and Neurosciences. It used to conduct a separate exam for MD in Psychiatry, DM in Neurology, MCH in Neurosurgery. MD Psychiatry, the best place for MD in India, even in Asia, is NIMHANS. They have a lot of seats, and they have super specialization in psychiatry also. Then DM in Neurology, 6-year integrated course. I think the only place in India to offer that. MCH in Neurosurgery, 6-year integrated course. So many students who are interested in this Apex Institute of Neuroscience in India, they used to ask a little heavier questions in psychiatry like this. Sometimes these type of questions do come in INI-CT as well. Philip Pinel. As I was talking to you about functional and organic, so anything organic, neurology, anything functional, psychiatry. So this was the introduction part of my subject. Okay, in this video we have only this much. In the next video I am going to start the chapter number 1, general psychiatry. Please follow for the next video.